Welcome back. We are at episode 6, and today I'm going to talk about the unlikely place where I learned some lessons about my massage business, and that place is urgent care. Before I get into it, I definitely have to tell you the story of how I learned my lessons. So it was Sunday morning. I woke up at 6:30 in the morning because I was going to visit my family in Michigan, and everyone in the house was asleep. But I woke up and I felt like there was an eyelash in my eye. I washed my face, I flushed my eyeball, no good. It was still scratchy, itchy, felt terrible, but I wasn't about to wake anybody else up, so I just left. I thought the eyelash would eventually fall out. It did not fall out. And over the rest of the day, when I got to Michigan, I had a sister examine my eyeball. She pulled my eyelid open like it was her job and couldn't find anything. I flushed my eye, put eye drops in, nothing happened, and it felt terrible. So the next morning I woke up and my eye was puffy over here. It was super red, and my whole eyelid was puffy. My eyeball itself was fine, so I knew it wasn't pink eye, conjunctivitis, but I did know there was something wrong with my eye, and my sister suggested that perhaps it was a corneal abrasion because she'd had one before. And I thought, how the heck do you get that when you're sleeping? So I drove home from Michigan on that Monday, 3.5 hour drive, drove straight to urgent care. Didn't even stop at home first. Was at urgent care. First thing I noticed was there were only a couple of cars in the parking lot. All right, good. We're on a roll here. Go into the waiting room. It's well lit. It's clean. It's very nice. So 2 good things so far. The receptionist, however, was a little, shall we say, disturbed that I had clearly interrupted her quiet evening. I was the only one in the waiting room. And so she just had me scan a code to fill out a form and told me to fill out paperwork. So I did all that. She took it, and I sat there. And I sat there. And I sat there some more. And I was the only person in the waiting room. I thought maybe the doctor's with somebody else. It's okay. So eventually I thought, I need to use the bathroom. So I had to ask where the bathroom was. And so she pointed it, didn't really say anything, got into the bathroom, came out, sat, waited some more. So once I was in the examination room, she checked my pulse, my blood pressure, all that jazz, typed away on her laptop. And then she said, the doctor is at another clinic. So if it takes her a little while to get here, that's why. And I said, oh, okay, no problem. By this time it was like 7:30 at night. They closed at 8. I thought, what am I going to be here? A half hour tops? No problem. Because my eyeball felt like there was sand inside of it. My eyeball hurt. It was like leaking water. And I thought I needed somebody to look at my eyeball. The strange thing is that when she was about ready to leave the examination room, she positioned the laptop so that it was facing me. Now, I was on a chair about 6 feet away from the laptop. And when she positioned the laptop, I could see in the upper right corner of the laptop that I was on camera. It was very small, a couple inches high maybe. And I thought, well, this is strange. And she left. And I thought, what are they doing? Are they spying on me? Do they have monitors in the front room? Are they seeing if I'm going to steal their stuff? Are they going to make sure I'm still acting injured or ill when I'm waiting for the doctor? I don't know. And I sat there, and all of a sudden, bing, the laptop comes to life. And there's the doctor, like the doctor was FaceTiming me, except it wasn't FaceTime, so I guess it was some sort of teleconference. I sat there like I am right now, just stunned that I was having a teleconference for my eyeball. And I was sitting 6 feet away from the camera. Now, she did not ask me to take a picture of my eyeball and hold it up to the camera on the laptop. She didn't ask me to come closer. She just asked me a few questions. And then she said that she would like to do a corneal stain. I think that's what it was called. But she couldn't because she wasn't there. I guess that shows if you have a corneal abrasion. And so she just prescribed me some antibiotics prophylactically, which means just in case. She said, do you have any questions? And I said, yeah, I'm a little frustrated because I thought you were going to look at my eye. And she said, yep, well, we can't look at it. So I called in a prescription for you to the CVS and you can go pick it up shortly. So I left. I asked the receptionist if I had any paperwork or if I was supposed to fill out anything. She said, nope. So I left the urgent care pretty much stunned at what had happened. And then when I got my medicine, I discovered that these little eye drops here, it says to put one eye drop, antibiotic eye drop, in each eye every 2 hours for X number of days, and then the instructions changed. And I did that, and then I thought, I don't even know if I have a corneal abrasion, and why am I putting eye drops in both eyeballs if I only have a corneal abrasion, supposed, alleged, a corneal abrasion in one eye? I was very distraught over this whole thing. I mean, it's my eyeball. I want somebody to look at my eyeball. Now, this is what I learned about my massage practice because of this urgent care visit. Number one, parking matters. So make sure that your parking is close and that clients don't have to worry about a long walk and that they'll have a parking space. I think that really matters a lot. Number two, your waiting room or your lobby, whatever you call it. I like it well lit. It doesn't necessarily have to be well lit, but it should be clean and uncluttered. So urgent care did very well on both accounts. And here's where they started to fail. Lesson number 3, the person greeting your client, your patient, if it's not you, or even if it is you, should be welcoming and they should not feel like they are interrupting your day. You should not be annoyed that they came in to get their massage. And even if you are annoyed because they're there 23 minutes early, you should probably still greet them with a warm welcome because that makes them feel welcome. Number 4, you should tell your new clients where the bathroom is because they might want to use the facilities before they go lie on your table for an hour or an hour and a half. And number 5, and this is the biggest lesson of them all, I think it's very important for you to tell your clients what's going on. You need to tell them, explain things to them. If they're a new time client, a first time client, explain to them how to get on the table. Maybe they've never gotten any massage before. Explain to them if you want them face down or face up. Show them that you want them to pull the covers up over them. Explain to them on what level of undress you would prefer them to be in. If you have a plan, say you're only going to work upper body, discuss that plan with them ahead of time. And then when they finish their massage, follow up with them. Tell them what they might expect. If you think they might be sore, give them some advice. Maybe they would like to soak in Epsom salt bathtub, maybe sit in a hot tub, maybe take a hot shower or go for a walk. Give them some follow-up advice. So those are the lessons that I learned from urgent care. So those are the lessons that I learned from urgent care in this past week, and see if there's anything that you might need to improve in your own practice for your client's comfort. Oh, I should mention, yes, it was probably a corneal abrasion, and yes, my eyeball is much better. And if you would like to create more of a VIP experience for your clients, I have a free giveaway, 63 ways to create a VIP experience for your clients. All you have to do is go to massagemomentum.com/63 ways, and that will be delivered right to your inbox. If you have any massage therapist or bodyworker friends that you think would benefit from this podcast, it would mean a great deal to me if you could forward this to them. And of course, if you could subscribe and hit the notification button so that every time an episode comes out, you'll definitely see it. I will see you in the next episode. And until then, keep your massage momentum.